Who pays for healthcare? The answer varies from country to country. While in some nations it is completely free for all residents, in others people often receive their health insurance through their employer. There are also places where you can only see a doctor if you pay. Often, a patient is faced with the choice of medium quality but cheap care versus high quality but expensive care. Unfortunately, providing healthcare to an entire nation of citizens is a complicated matter. While different healthcare systems have various advantages and disadvantages, no system is ideal. Within the countries which provide free public health care, there are many models. In some countries, consultations, treatment, and medicines are free to all citizens. This may be paid for directly by the government, perhaps funded by the country's valuable natural resources that the government owns. Other countries collect money from citizens through taxes based on their income. Workers pay according to how much they earn, and employers also make a contribution. Hospitals and other medical services are then provided and run by the government. There may also be some private medical services which people can choose to buy. The advantage of systems such as these is clear: free basic health care for all, regardless of income. However, it is a very expensive system, and as life expectancy and costs rise, many countries are facing either an unsustainable financial burden or a drop in the quality of services and facilities provided. In countries where citizens use private providers, healthcare is only available to patients who pay for it, and healthcare providers are commercial companies. In wealthier countries, most citizens take out health insurance to cover their potential medical costs. However, not everyone can afford this, and some governments have a scheme which gives financial assistance to those who need urgent medical care but are unable to afford it. In other nations, there is no such safety net, and those who cannot pay simply do not get the health care they need unless they can get help. The disadvantages of this system are obvious. Not only are individuals deprived of the medical attention they need, but also the lack of preventative medicine means that infectious diseases can quickly spread. One advantage, however, is that commercial organizations can sometimes provide higher quality care than struggling government-funded ones. In many countries, there is a mix of public and private funding. This system requires all its citizens to take out health insurance. This is deducted from salaries by the employer, who also has to make a contribution for each worker. Citizens are able to choose their healthcare providers, which may be public or private. However, in some systems, private companies are not permitted to make a profit from providing basic healthcare. This model provides more flexibility than either the public or private models and ensures access to healthcare for all. However, it has been criticized for driving up the cost of labor, which can lead to unemployment. Most of us will likely agree that no healthcare system is perfect. Several countries are now considering a combination of the models for their national health systems. The challenge is to find a system which provides a high-quality level of healthcare to all citizens, but which is also affordable and practical. Whether or not such a system can work remains to be seen.